Chapter 23, Bowel Elimination. We are now in the 23rd chapter. You are just about halfway through. You are halfway through this course now because there's 46 chapters. Remember you must read and take notes, review, study, and comprehend all the topics. You need to know the key terms and key abbreviations. You need to focus on all the boxes and tables and all the figures. Read all the reviews and teamwork and time management, time to reflect, and quality of life, and make sure you do the review questions at the end of the test. Check your answers in the back. We are going to go ahead and start. We're passing the contents. You can read those because we're going to go over them anyway. And just want you to read back over those though. The bowel elimination is the excretion of wastes from the gastrointestinal GI system. Factors affecting bowel elimination include privacy, habits, age, diet and fluids, exercise and activity, and drugs, medications. Bowel elimination is a basic physical need. Gastrointestinal system, the GI system, promote normal bowel elimination, and it's important. You assist residents in meeting elimination needs. If you need a review, you can go back to Chapter 8 on your gastrointestinal system. Bowel elimination, the normal bowel elimination. Feces move through the intestines by peristalsis. Feces move through the large intestines to the rectum. Feces are stored in the rectum until excreted from the body. Defecation bowel movement, BM, is the process of excreting feces from the rectum through the anus. Frequency and time of bowel movements vary from person to person. When having partially digested food and fluids are called chyme, C-H-Y-M-E. C-H-Y-M-E. Feces refers to the semi-solid mass of waste products in the colon that is expelled through the anus. Peristalsis is the alternating contraction and relaxation of intestinal muscles. Stool refers to the excreted feces. Stools are normally brown, soft, formed, moist, and shaped like the rectum. They have a normal odor. It stinks. Observe and report the following: the color, amount, consistency, presence of blood or mucus, odor, shape, frequency of defecation, and complaints of pain or discomfort. And sometimes if someone has blood in the stool, you can smell that blood in that stool. But and also you can see the blood, the redness. Bleeding in the stomach and small intestine causes black tarry stools. Bleeding in the lower colon and rectum causes red colored stools. Diseases and infection can cause clay color or white pale condition, orange colored or green colored foods. And also if you eat kale or spinach, something like that, that can also cause your stool to be green too. The normal color is caused by bacterial action in the intestines. Certain foods and drugs also cause odors and also cause your stool to be a different color too. Ask the nurse to observe abnormal stools when you sit, let her know about it. Okay. Also check in the book, the review focus on communication. Factors affecting bowel elimination. The nurse considers the following factors when using the nursing process to meet the person's elimination needs: privacy, habits, diet, fluids, activity, drugs, aging, disability. The care plan includes measures to meet the person's elimination needs. It may involve diet, fluids, and exercise. Make sure you review the teamwork and time management, safety, and comfort in the textbook for Chapter 23. Constipation is the passage of a hard, dry stool. Constipation occurs when feces move slowly through the bowel. A fecal compaction is impaction is the prolonged retention and buildup of feces in the rectum. Feces are hard or putty-like when the individual is impacted. Symptoms include abdominal discomfort, abdominal distension, swelling of the abdomen, nausea, cramping, and rectal pain. Older persons may have poor appetite, confusion, or even a fever. And believe me, and there's a certain drop-off on this too. Let's go back to the urinary elimination. When a young person has a urinary tract infection, they feel the pain. They have urgency to go to urinate. Whereas it flips in the elderly. In the elderly, they become confused and combative. It's just a pure sign of a UTI with an elderly person. You know that person's personality. You know they're nice. You know they don't argue and fight and stuff. But all of a sudden, they're getting ready to attack you. They're confused. They're irritated. Check that urine. Have the nurse tell that nurse so they can get a specimen to see if they have a UTI, because that is what's happening to the elderly person. Also, with the elderly, when they have an impaction, they become confused. They even have a fever. Okay, so remember that. That is just something that you need to know when you go. That's the real world. Fecal impaction results if constipation is not relieved. Common causes of constipation include a low-fiber diet, ignoring the urge to have a bowel movement, decreased fluid intake, inactivity, drugs, aging, and certain disease, and certain conditions. Dietary changes, fluids, and activity prevent or relieve constipation. So do drugs and enemas. In fecal impaction, the person cannot defecate. Report signs and symptoms to the nurse. The nurse does a digital exam to check for an impaction. A lubricated gloved finger is inserted into the rectum to feel for that hard mass. The digital exam often causes the urge to have a bowel movement, which is good, so try to get it out. Sometimes the nurse removes the fecal mass with a gloved finger. This is called fecal removal of impaction. A gloved finger is used to check for a fecal impaction. And that's a diagram of one. Here it shows insertion of going into the rectum, where they're inserting a suppository on the left-hand side. On the right-hand side, the enema tube is being inserted, as you can see. Diarrhea and dehydration. Diarrhea is the frequent passage of liquid stools. Feces move through the intestines rapidly, causing fluid loss. If fluid is not replaced, dehydration occurs. Dehydration can lead to death. Clostridium difficile is a microbe that causes diarrhea. Signs of dehydration: pale or flushed skin, dry skin, coated tongue, urine is dark and scant in amount, thirst, weakness, dizziness, confusion, and falling blood pressure and increased pulse. So with diarrhea, the need for a BM is urgent. Abdomen cramping, nausea, and vomiting may occur. Causes of diarrhea include infection, some drugs, irritating foods, and microbes in food and water. Dehydration is the excessive loss of water from tissues. Microbes can cause diarrhea. C. diff, which is Clostridium microbe, is found in feces, and they just call it C. diff. The Clostridium is just C. diff because it is hard to say. A person becomes infected by touching items or surfaces contaminated with feces and then touching his or her mouth or mucous membranes. You can spread the microbes if your contaminated hands or gloves touch a person or contaminated surfaces. Preventing the spread of infection is important. Follow good hand hygiene practices as well as standard precautions and the blood-borne pathogen standard. Please review promoting safety and comfort diarrhea in the textbook. Fecal incontinence. You have fecal incontinence is the inability to control the passage of feces and gas through the anus. Fecal incontinence affects the person emotionally. The person with fecal incontinence may need bowel training, help with elimination after meals, or every 2 to 3 hours. Incontinence produces to keep garments and linens clean, good skin care. Fecal incontinence affects the person emotionally. Causes may include intestinal distress, nervous system diseases, and injuries. Fecal impaction, diarrhea, and some drugs, chronic illness, aging, mental health problems, or dementia. The person may not recognize the need or act for having a BM, not answering call lights when help is needed for elimination, getting to the bathroom in time, and finding the bathroom in a new setting. Review residents with dementia, fecal incontinence in the textbook. Flakiness. Flakiness is the excessive formation of gas or air in the stomach and intestines. Gas and air pass through the anus called flatus. If flatus is not expelled, the intestines distend. Abdomen cramping or pain, shortness of air, and a swollen abdomen also occurs. So, review the causes of flakiness listed in the textbook. Doctors may order enemas and drugs to relieve flakiness. Bowel training. Bowel training is used to gain control of bowel movements, develop a regular pattern of elimination. Fecal impaction, constipation, and fecal incontinence are prevented. The person's usual time of day for a bowel movement (BM) is noted on the care plan. The nurse tells you about a person's bowel training program. Offer help with elimination at the times noted on the person's care plan. Factors that promote eliminations are part of the care plan and bowel training program. These include a high fiber diet, increased fluids, warm fluids, activity, and privacy. The doctor may order a suppository to stimulate a bowel movement. A suppository is a cone-shaped solid drug that is inserted into the body opening. It melts at body temperature. A nurse inserts the suppository into the rectum. A bowel movement occurs about 30 minutes later. Enemas. The introduction of fluid into the rectum and lower colon is called an enema. Doctors order enemas to remove feces, to relieve constipation, fecal impaction, or flakiness, to clean the bowel of feces before certain surgeries and diagnostic procedures. The doctor orders the enema solution. Given an enema on the left side, you will see the person is in a sealed position. The enema bag hangs from an IV pole. The bag is about 12 inches above the anus and 18 inches above the mattress. On the right-hand side, the small volume enema tip is inserted 2 inches into the rectum. Again, the person is in sealed position. Now, remember this. You're not the nurse, but because you won't be doing that. But when the nurse does insert anything in the rectum or in the vaginal area, you always do it ever so gently, because eventually you will be going to get your LPN or RN, and I want you to know this. So you ever so gently go in, and because you never know, if you meet a resistance, you're supposed to stop and come out immediately, because you never know if you have a prolapsed vaginal uterus or a prolapsed rectum. So always stop and you immediately call the doctor. 17, on the 17th slide is still enemas. The solution depends on the enema's purpose. Tap water enema obtained from a faucet. Saline enema is a solution of salt and water. Soap suds enema is SSE. Small volume enema or retention enema. Do not give enemas that contain drugs. Never. And it's some nurses usually are the one who will administer the enemas also. Other enema solution may be ordered. Consult with the nurse and use the center's procedure manual to safely prepare and give enemas. Do not give enemas that contain drugs. Nurses give them. Cleansing enemas: clean the bowel of feces and flatus, relieve constipation and fecal impaction, are needed before certain surgeries and diagnostic procedures. Tap water enemas may be dangerous. The saline solution, enema solution, is similar to body fluid. Soap suds enemas, SSE, irritate the bowel's mucous membrane. So cleansing enemas can take effect in 10 to 20 minutes. The doctor may order enemas until clear. This means that enemas are given until the return solution is clear and free of stools. Ask the nurse how many enemas to give. Center policy may allow repeating enemas 2 to 3 times. Please review giving a cleansing enema procedure in the textbook and make sure you know about them and how long each one takes. Small volume enemas irritate and distend the rectum. They are often ordered for constipation. They are ordered when the bowel does not need complete cleansing. Oral retention enemas relieve constipation and fecal impaction. The doctor may order enemas until clear. This means that enemas are given until the return solution is clean and free of stools. Ask the nurse how many enemas to give. The small volume enema tip is inserted 2 inches into the rectum. Make sure you review giving a small volume enema procedure, promoting safety and comfort, the oral retention enema in the textbook, and review giving an oral retention enema procedure in the textbook also. Ostomies. An ostomy is a surgically created opening for elimination of body wastes. The opening is called a stoma. The person wears a pouch over the stoma to collect stools and flatus. Colostomy. With a permanent colostomy, the diseased part of the colon is removed. A temporary colostomy gives the diseased or injured bowel time to heal. The colostomy site depends on the site of disease or injury. Stool consistency depends on the colostomy site. Skin care prevents skin breakdown around the stoma. Sometimes part of the intestine is removed surgically for different reasons, such as cancer, bowel disease, and trauma. Feces and flatus pass through the stoma instead of the anus. The colostomy site depends on the site of disease or injury. Stools irritate the skin. The skin is washed and dry. Then a skin barrier is applied around the stoma. It prevents stools from having contact with the skin. The skin barrier is part of the pouch or a separate device. Here's an ileostomy, stoma, down at the bottom. The entire colon is removed. Liquid stools drain constantly from an ileostomy. The ileostomy pouch must fit well. Stools must not touch the skin. Good skin care is required. Definitely required. An ileostomy is a surgically created opening. Stomy is between the ileum, small intestines, ileo, and the abdomen wall. Part of the ileum is brought out onto the abdomen wall and a stoma is made. The entire colon is removed. Water is not absorbed because the colon was removed. Feces in the small intestine contain digestive juices that are very irritating to the skin. The right side is one-piece colostomy pouch. Ostomy pouches are empty when stools are present. The pouch is open when it balloons or bulges with flatus. The drain is wiped with toilet tissue before it is closed. The pouch is changed every 3 to 7 days, and when it leaks, frequent pouch changes can damage the skin. The person can wear normal clothes. Showers and baths are delayed 1 to 2 hours after applying a new pouch to allow the adhesive to seal to the skin. Do not flush pouches down the toilet, please. The pouch has an adhesive backing that is applied to the skin. Sometimes pouches are secured to stoma belts. Odors are prevented by good hygiene, emptying the pouch, avoiding gas-forming foods, and putting deodorants into the pouch. The nurse tells you what to do in doing that. You need to follow the center policy for disposing of pouches, review dedication guidelines for ostomy pouches, and safety and comfort, promoting safety and comfort for ostomy pouches in the textbook, and review changing the ostomy pouch procedure in the textbook. So those are the things that I've mentioned before in reviewing your work. Colostomy sites. A, you see the stomach onto the right side, and it's going down D, down descending. It's a sigmoid or descending colostomy. You go to B, and it's a transverse colostomy. It's going across the stomach. C, it's on the right side of your body, and it is ascending colostomy because it is going up. You see, it's going up. And then D, you have stoma, and it is a double barrel colostomy. It has 2 stomas, where they had to cut away the intestines. One allows for the excretion of feces, and the other is for the introduction of medications to help the bowel heal. Quality of life. Protect the person's rights. Assist with bowel elimination is directed by the nurse and the care plan. Do all you can to protect the person's right to privacy. Residents have the right to personal choices. Bowel control is important to people. Physical and mental well-being are related to normal bowel functions. Normal bowel elimination is not always possible. Constipation, fecal impaction, diarrhea, fecal incontinence, flakiness are common problems. Persons with ostomies manage their own care if able, and some have had ostomies for a long time, and they have their own routines and care measures, and sometimes they might need help, and you can just follow along with their instructions to tell you. That is the end of the chapter 23, bowel elimination. Have a good day.